It's been said that implantology is a prosthodontic-driven protocol with a surgical component. Your patients just want a functional, long-lasting, and aesthetically pleasing set of teeth. They don't care about how you make it happen. They just want the job done right. Implant planning is like building a house. If you were building a house, you'd start with a sketch of what you generally want the place to look like. You'd give that to an architect, who would then in turn draw a line drawing. An engineer would then turn the line drawing into a frame plan. And yet another engineer would take that frame plan and determine what foundation would be needed to support it. Once all of this planning is done, a crew pours the foundation and builds the house up from there. Now imagine if we did this the other way. What if you bought some land, hired a contractor, and told them, go pour me a foundation? You don't tell them what the house should look like, and you don't give them any plans for it. The contractor finishes the foundation and base walls, and it looks like this. At this point, you realize you really wanted a place a lot bigger. This looks like what? A garage with a shower? Not exactly the 3-bedroom you'd hope for. Not only that, but you realize the foundation encroaches on your neighbor's yard. You point this out to the contractor, and the contractor says, yeah, but the dirt was better over here. Now you have a huge problem. Your foundation is too small and it's hanging over your neighbor's property line. There's no way you can get the house you wanted now. This is exactly what we do when we use an anatomically driven protocol to place implants. With an anatomically driven protocol, all we look at is the location of the bone. It's a get implant in bone mentality. We're not thinking about the function or the aesthetics of the final prostheses. We're only considering how we get our implant to stick in the bone. Why would we do this? Why would we pour the foundation without making the blueprint for the house? Our patients come to us not because they want implants, but because they want teeth. If we get implants in their mouth successfully, but they have access holes right through the center of the front teeth, we didn't give them a good solution. If our occlusion isn't correct and we add significant failure risks to our patients' full arch restorations, we didn't give them a good solution. The only way to give our patients the solution that they want and deserve is to use a prosthodontic-driven protocol. This applies to single implants and full arch cases alike. In a prosthodontic-driven protocol, we plan the final restoration first. Before we even look at where the implant will go, we use our patients' photos to mock up their new smile, just like the sketch of our house. That's our starting point. Once we know where we want to place the patient's teeth, we use our 3D and optical scans to figure out the ideal location to place our implants to support our prosthodontic solution. If the patient doesn't have enough bone somewhere, we graft and grow some. If we can't place an implant in a particular position, we can use minimal cantilevers to accommodate. There's almost always a solution that allows us to create a safe and secure prosthetics for everyone. The key is starting with the house plan, not the foundation. This has been another episode of Implants Made Simple. Smile Engineer, out.